Hi guys, Tash here with Ninja.
Hello.
So Ninja's our stand-in today for our treatment. We're going to be talking about endometriosis and the effects on the body, especially in that pelvic and hip region and the tension that it can cause. So I'm using Ninja's body today because we're working on the hips, and yeah, male or female, we all have these hip muscles, and I'm just going to show you where I'm going to work on Ninja. So I'm going to get into the iliacus while I discuss what we're doing, all right? So I'm just sinking nice and slow. It can be a little bit touchy, this area. You really want to exaggerate our sink in, I think, on this hip region. All right, so you can see that's the bone there for Ninja. So I'm connected to that bone with my thumb, but I'm just started, pressing in and introducing some pressure onto that iliacus muscle, which is one of the hip flexors. All right, so we're talking endo. Do you know much about it, Ninj?
Not too much. It's fibrous growths or something like that on the insides and the uterus. Did you say?
Yeah, and coming out as well. So,
and a lot of girls, how many 50% or how many? What do you know? Any percentage? No.
Well, I think actually don't know right now, but it's just becoming, because it's more being diagnosed more, which is why we're getting so much more knowledge, right, around it, which is great because it's been undiagnosed for a long time.
Yeah.
So those numbers are probably increasing rapidly because it was that or misdiagnosed for so many years as just a bad period when you shouldn't be experiencing pain to that extreme, and what it can do in here, this pelvic region. So a lot of people, when they're suffering they'll get cramps from the discomfort and, actual cramping in the area causing the pain to this region. What I've seen a lot with my clients is that if they're in the fetal position, seems to be like the best position to relieve discomfort. If you're stuck in that position for quite a while, you're going to be shortening all of these tissues in your hips, in your pelvis, all around, even in your stomach, your abdomen. So being in this fetal, baby, tucked up position. So shortening of all these guys, making them pretty unhappy. But it's easy to think or, not hard to distinguish the difference between tension and discomfort from the tension in the muscles and the endo pain sometimes, and I guess you're having the endo pain quite often. It's easier to kind of have it all wrapped up into this one general pain going on. So I just want to draw awareness to the fact that you can get some relief from freeing up the hips, coming in here, allowing me to get into these hip regions, TFL as well, even through your quads, even through your abs, through your obliques, even maybe through diaphragm, anything that's shortened in that tucking over position. We can help lengthen it again, free it up again, and provide you some sort of relief from what you're experiencing. So, a few other conditions similar to endo, same thing, pelvic pain, cramping. So anything like that, there is, a way that you can possibly help yourself, especially if you are someone waiting for some severe, to have some surgeries, or sometimes there's a long length of waiting to see a specialist, and it's what can you do in the meantime? Well, this is something you can do. All right, so we can also give you, stretches and release work that you can do on yourself to help and manage. But this is just one way we can help you in this area of the body. Yeah.
Cool.
Yeah, so hopefully a lot of people see this video and can relate and can come in and get some treatment to help themselves out. But it's just good for us practitioners to be aware, I think, of how we can help as well. Yeah. Got to help the girls out, Nind.
Yeah, true.
All right?
True.
Yeah. How you feeling?
Yeah, it's good.
It's okay?
It's a very connected treatment. Mm-hmm. And this is like a bit of a vulnerable area it can be, like more intrusive, if you want to call it that. But if you kind of approach it in the right way, you can feel safe, and then you can kind of let people have access into bits where you need work, even though it is painful, but a good pain. You know, it's rewarding once it's cleared out.
Exactly.
Cool.
Yeah. So if it helps, like, I think it's a good place. We offer a very safe and welcoming clinic environment here, so you should feel really comfortable coming and seeing anybody here. But if you need to see a female, book in with a female, book in with myself, to give you that extra, security and safety, and understanding. And yeah, someone will always be able to help you out here at MMT.
Good.
All right. Yeah. So come in. Feel free to email us. Call up if you have any more questions. But happy to help and free you up and get you living more of a pain-free life.
Yeah, sounds good.
Yeah, awesome. Thanks, Ninj.
Get
Being
done.
my body
Yeah,
for the
it's
day.
all right.
I'll see you soon.
Done.